is a patient. Dr. Larry Mróz is a patient engagement coordinator with the BC Support Unit. In this role, he helps health researchers in BC to work with non-researchers, including patients, who want to understand what health research is being done, why the research may be important, and how they might contribute to making research more relevant. Larry is also a health researcher whose health research has focused on understanding how people experience living with various health conditions and how their experiences may affect their healthy behaviors. Kristi Coldwell, who you saw yesterday, is the Senior Advisor for Transplant Research Advocacy at the Transplant Research Foundation of BC. Having undergone a heart transplant as a teenager due to congenital heart disease, Kristi is acutely aware of the role research plays in improving outcomes, enhancing quality of life. She believes patient and family partners have an important role in shaping and informing research to ensure it is meaningful and accountable to all stakeholders. And lastly, Aggie Black is the Director, Health Services and Clinical Research and Knowledge Translation at Providence Healthcare. Working closely with patient family partner advisors, Aggie supports clinicians in research projects, including leading the practice-based research challenge. She is an adjunct professor at the UBC School of Nursing and Research Associate, Center for Health Evaluation and Outcome Sciences. Over to you. Take it away.
Great, thank you, everyone. I just need to share my screen here and get started. Just give me 1 second.
You're seeing your oh,
There we go. Great, thank you. So good afternoon, everyone, and welcome back from your lunch. I hope you had an opportunity to get some nourishment and a bit of physical activity and a stretch and that you're ready to go again. So I'm going to start off with just a bit of a story. My dog literally just got skunked, so my eyes are watering and I'm choking a bit here. So if you see me blubbering away here, that's I'm not crying, I'm just being fumigated by my dog. So anyway, we'll just go with the flow, and you'll be just very thankful that you don't have to smell my house right now, or me, or my dog. So anyway, with that introduction, it's my pleasure to join you and then to work with this illustrious panel that we have put together for you today. So we're going to be spending the next 30 minutes presenting on a project that we did in BC, exploring patient and family donor partner reviewers in practice-based research. And I'm just going to start with, thank you very much, Mary, for that introduction. I think I'll just introduce myself briefly, as I am Lynn, obviously. And my role today, it will be moderating this panel. And I'm just going to let Aggie and Kristi and Larry also just briefly introduce themselves.
Hi, everybody. I had a safer encounter with a skunk a couple nights ago when I got to watch from my window when a mother skunk brought her 5 little babies out to play in the neighbor's backyard, but I didn't get skunked. No. It was a safe and non-odorous encounter. As Mary said, I work at Providence Healthcare, which includes St. Paul's Hospital in downtown Vancouver, British Columbia. And my role for this presentation is as the coordinator of a practice-based research initiative that had the privilege of working with patient family partner reviewers.
Hi, everyone. Great to see some familiar faces from yesterday. I am not worried about a skunk, but I'm very worried about the doorbell going because I've got 5 little dogs. So I do apologize in advance if that happens. So as you know, I'm with the Transplant Research Foundation of BC. And for this project, I have served as a patient partner lead, helping to advance this important work.
Hi, I'm Larry. I'm also at the support unit. I don't have any skunk stories, sorry, but I do have an old dog. And my role in this project was to help with the qualitative data analysis. So I support the research teams that are part of the research challenge, but I also support the peer review process and the this project where we asked peer reviewers about their experience. So we're going to hear more about that.
Great. So thank you, everyone. And I'll just briefly introduce what we're hoping to cover in the next 30 minutes. So we're going to look at just briefly introduce what do we mean by practice-based research and patient-oriented research. I think you're probably all familiar with what we mean by patient-oriented, but you may not know what practice-based research is. We'll just introduce you to this collaboration of health organizations in BC that are supporting a number of practice-based research programs and the work that we are doing with them. And as we mentioned, we're going to describe a project that we looked at exploring patient family partner reviewers' experiences in these programs. And we hope to spend most of the time sharing our key learnings from this project. So less about how we did it and more about what we found. And then also we'll enter into a bit of a discussion about how we think we're going to be using these recommendations as we move forward with the next round of practice-based research. And of course, we want to make sure that we give you the opportunity to, ask questions and participate in this discussion. So Larry will be monitoring the chat. So if you have any questions that you'd like us to address, please feel free to put them in the chat. And we'll also make sure that at the end that we leave us, a significant amount of time for us to have some further discussion and questions with you as the participants in this panel. So that's kind of what we're going to do. And so let's get started. And so I'm going to start this off by having Aggie introduce to us, what do we mean by practice-based research?
Okay, this is a question I get asked from time to time. So I think of practice-based research as research that happens right at the bedside. It's led by people who primarily have a clinical role. So they aren't, generally they don't have a PhD, they don't have a strong research background, but they have important research questions that are directly relevant to their clinical practice. Because these projects happen right at the bedside, it's the questions they ask are immediately relevant. And our hope is, anyway, that the findings from those projects are smoothly translated into practice to improve care for patients. All of our teams are mentored by experienced researchers. So often that's someone like Larry or Lynne, who does have some more experience with research. In British Columbia, we have practice-based research programs at my organization, Providence Healthcare, and at least 2 other organizations that I know of, or 2 other health authorities. In our practice-based research initiative, we provide some training because, as I said, some of these teams are really new to research. We provide funding, small amounts of funding, $5,000 a year. So these tend to be smaller studies, and our role is helping the team scope down their big research question into something that's small and manageable. We run our initiatives every year. So every year we fund, at my organization, around 10 or 12 projects.
Great, thank you. Aggie, sorry, I might be choking up a little bit here today. I apologize. So yeah, thank you. I'm just wondering, Kristi, if you might want to maybe discuss how these practice-based research projects, little R research, we'll call them, might be the same or different than maybe some of the research that the CDTRP is more likely to be funding.
Yeah, for sure. Thanks, Lynn. So I would say that one of the main differences, in addition to what Aggie has already spoken to, is that because for a lot of these projects, they are newer researchers, that they really are, in fact, focusing more on the practical research. So more of the applied research. It's very context specific, whereas compared to a lot of the research that's undertaken as part of the CDTRP, where their investigators are more experienced, they're more seasoned, they're asking questions that are novel, they're more innovative. So there's more proof of concepts and pilot studies. And this means that those projects are in large part, they're quite scientific. They can be more of the bench research. And they also have the possibility to really have broader implications for our healthcare system. Not to say, of course, that those practice-based projects don't, but again, those are more context-specific when it comes to the practice-based.
Great, thank you, Christine. I think what we'd like to do as part of our panel today is tie in why, even though this project was focusing on practice-based research, pretty well we believe that the recommendations that are arising from this evaluation would apply across any program that works with reviewers to help support their funding decisions. So that's we're looking forward to having that and bringing that up as part of our discussion. So thank you for that. So Larry, I'm going to pass it on to you here to ask you, can you just explain a little bit about what our collaborative is?
Absolutely. So the collaborative is a group of organizations who are all doing practice-based research in their own institutions in some capacity. And they're all doing it autonomously. They're all independent organizations like Aggie's with Providence Health. And they are all at different stages of the development of their programs. Some of them have been doing them for a long time. Some of them are just getting started. And Lynne and I at the support unit, we have the great pleasure of working with each of these organizations and helping them build out patient-oriented research in their practice-based research programs. So basically what we do is we just help them make sure that patients are engaged in the governance of the programs and involved in the research projects, and of course in reviewing proposals. So over the last year and a half, we created this loose collaboration of these organizations, and it just gives us an opportunity for Lynne and I to just do some really good work with them and to help ensure that we're not duplicating efforts, that we're communicating, and that we're all working together to ensure that we're all doing the best practice-based research programs that we can.
Great, thank you, Larry. And I'm wondering, Kristi, if you can speak to we have this group or collaborative of organizations that are running practice-based research program, but we also have what we call the PERC, and it's actually is the acronym for the Patient Engagement Research Collaboration. Can you tell us a little bit about how it runs in parallel with the in collaboration with this collaboration?
For sure. So our PERC is composed of a group of really dynamic individuals, all of which have diverse lived experience with our healthcare system. So this includes patients as well as caregivers, and there is representation from all of those participating health authorities or organizations. And what we do is we work alongside that larger collaborative, really helping to integrate, to strengthen and advance a patient-oriented research approach. So ensuring that lived experience perspective into the various research programs. And we do this by not only supporting existing patient and family partners that are involved in those research programs, but we also offer additional trainings and opportunities for capacity building. And I do just want to briefly make a note about language, that even though for our discussion today, you're going to be hearing us refer to patient family partners or patient partners. And over the course of the 2 days, you may have heard them referred to as patient, family, and donor partners. But just know that regardless of the language or the terminology that's used, we are referring to persons with lived experience. So it's all of the same sort of group that we are discussing today.
Great, thank you. And then follow up to that, Kristi, I'm wondering if you can just Larry mentioned that, a patient-oriented approach is more than just having a patient partner on these different teams. I'm wondering if you can just kind of highlight that again.
So a patient-oriented approach is really about ensuring that individuals who have that lived or that living experience related to the research are actively and meaningfully engaged in that research. And so it is more about, and it's also about really, I guess, recognizing that there's these various opportunities and there's these roles, and that they can be more than just a patient partner on a research team. Even though that is an amazing and that's a great way and role to fill, they can also be involved in the governance committees, advisory councils, and also serve in proposal reviews for funding. And that is actually what is the focus of our discussion today. So we're going to be exploring more about patient and families' experiences as reviewers.
Great, thank you. So building on that, Aggie, why did we think we needed this project?
So we knew, I knew that my organization was working with patient family partners as reviewers of these practice-based research grants. I knew some other people were doing it, and we thought that doing this project would be a chance for us to align and kind of streamline the way we were all doing it. So we figured some of us were doing it one way, some were doing it slightly differently, but there must be some best practices in terms of patient family partner reviewer, both how do we orient people, how do we invite patient family partners to take on this role. So we wanted to evaluate to see what did the reviewers we were working with, how did they feel about the orientation they had received and the experience of doing the reviews? And then most importantly, what advice did they have for us, for all of us who were coordinating these practice-based research initiatives, for how we could do this better? We didn't want it to be a token thing. We didn't want it to be a one-off that we just did this because we felt like it. We really wanted to be doing this carefully and thoughtfully with involvement from the patient family partner reviewers. And we also wanted them to know what we were doing with the feedback they gave us on these proposals. So I think really it was a chance to align the way we were doing this, at least across our programs in British Columbia.
Great, thank you, Aggie. And does that kind of sit where you were thinking from the patient reviewer perspective?
It does. So I was hearing from a lot of our patient partners who had been involved in more than one review that there were a lot of differences. There were a lot of discrepancies when it came to the training, to the actual process, and that they really felt that there was opportunities for improvement and for better consistency and coordination across the programs.
Great, thank you. So Larry, what is it we wanted to achieve with this project?
Well, basically, excuse me, I'm losing my voice here. Basically, we wanted to find out from the people that were doing the patients that were doing this review, the partners that were doing these proposal reviews, what it was like for them. And really, this is really kind of walking the talk in the sense that we're doing this process. We need to find out if it's working for the people who are doing it, both for the benefit of the organizations, but also for the benefit of the reviewers who spent the time. So to do all this work. So we wanted to ask them, what was it like? How can we do it better? Simply, we wanted to know what they could tell us to improve and to have a better improved process at the end.
Yeah, so Kristi, so can you just briefly outline how we gathered this feedback?
Of course. So we invited 13 of the patient family partners that had been involved in some capacity in the peer reviews, really wanting to learn more about their experiences. And we created a series of questions that really aimed to elicit this feedback around what their experiences were like, what worked, what didn't work, what could be improved. And so we wanted to ensure that this was going to be fruitful. So we knew we needed to have a safe space for these discussions. And so of these 13 individuals, all were really willing to participate, and they were all quite forthcoming with their feedback and with their insight. So of these sessions, they were all recorded and transcripts were produced. And Larry, I know you're going to tell us a little bit more about what we actually did with these transcripts.
Thanks, Kristi. Yeah, so my background is qualitative health research. So we use that sort of lens and that sort of approach to really help us to understand what we were being told by the patient and family partner reviewers who took part in these discussion groups. So we did this thing called a thematic analysis approach. And that's simply, we took these conversations, we reviewed them and looked at them and found there's some general themes that kept emerging. So we grouped those themes and we created categories and started to really describe what was happening, so we could get a sense of, what the partners were saying and what we could actually do with it. So we took this after we had a stab at sort of understanding what the general themes were. We condensed these pages and pages of transcripts down to these discrete categories, and then we sent them back to the people who took part in the discussion groups and got them to look at it, to ask, did we miss anything? Did we record the right things? Are we actually on the right track here? And they sent us back some really good feedback. And fortunately, we were mostly on track, but there were a couple of things that they wanted us to highlight.
Great, thanks. And so Aggie, what do we take with this final compliment? How do we take that initial information and try and boil it down?
Well, as Larry said, there was lots and lots of information. If for any of you that have done this sort of work, you get every conversation has pages and pages of transcripts. So we sifted through that, made these themes, as Larry said, and then we really tried to think about what could we come up with that would be recommendations arising from this. So people like me who are coordinating the research, the practice-based research initiatives, could think about how could we be doing this a little differently to have the work be meaningful. It was already meaningful for us. Like, we were getting the benefit of some incredible advice and guidance from the patient family partner reviewers, but how could we make sure that it was working for them? So we had a smaller working group made up of committee members that included myself and another person who coordinates practice-based research, along with some patient family partners who'd been part of the review process. And we came up with a list of many, many recommendations. And today we're going to provide, or in the next few slides, we're going to provide a few of those highlights. And then Kristi, I think, is going to explain the working group process a little bit more.
Yeah, so let's fly through these next slides a little bit and just kind of, Kristi, just get to this so that we can actually get
sure.
through to the recommendations?
So we took this information, we made it into something that was more workable. We recognized that these themes could be grouped into recommendations that fell within 4 main categories around the peer review. So that includes the recruitment, the engagement, the reviews, and the debrief.
Great. So thank you. So Larry, can you just give us an overview of what were kind of the key recommendations or findings around, making sure that we were helping people to be recruited and knew what they were doing?
So the very first thing that the organizations need to do is to recruit patient family partners to join the review process. So this seems like it should be very, very transparent and easily done process, but in fact there was a bit of confusion from some of the participants as to what they were actually getting themselves involved in. So it was really important for us to make these recommendations that the recruitment materials were clearer about what was expected of the patient partners, even if they had an experience of patient-oriented research, which they found to be helpful. They still needed to know what sort of time commitment was this going to be? How are they going to be communicated with? What were they actually going to do before they could agree to be a part of the review panel? The last thing you want to do is get a partner involved who doesn't know what they're doing and then decides not to take part. So this was the very, very first step, I think, was recruitment.
Okay, so the next one here is about, how do we make sure we're providing them, once they're recruited, appropriate support and training? So I'm wondering, Aggie, what were some of the key messages about that?
One of the recommendations was that the format for the training should come in a variety of ways. So not everybody wanted to participate in person, not everybody wanted to participate in online. Some people just wanted to have a little written notes and reminders. People wanted examples of proposals. So what did a typical practice-based research proposal look like? What were the sections of it? What did we want them to focus on? And then people really like the idea of having a mentor. So Kristi, for example, has been a patient family partner reviewer, and she has volunteered in the past to mentor some of the newer patient family partner reviewers. So if I'm new to this role, I know I've been at least introduced to Kristi by email, and I know that I can call her if I have a question. We also, this may come up a little bit later, but we also were recommended that there be one person at each organization. So for Providence, it's me, to whom the patient family partner reviewer can turn at any time if they have questions about what is it I'm supposed to do? When are these due? Am I supposed to review the whole proposal? Any questions at all about it? We thought we should make it really, really clear who can they go to with questions.
Great, thank you. And so, Kristi, what were some of the recommendations around how do we support them when it actually comes to doing the reviews?
So some of the key recommendations that were related to the proposal reviews as well as the review panel meeting itself. So related to the proposal reviews, when PFPs were looking at the applications and formulating their feedback, although a lot of the programs provided templates which they could populate with their input, it was recommended that additional support, guidance, and resources were needed to better prepare them to understand how to approach these applications, to understand what it was they were looking for, and how to articulate their feedback. So something along the lines of a handbook that they could reference as they did their reviews was seen as useful. And then when it came to the scoring or rating system, greater explanation around what that was needed. So I do want to just briefly highlight that PFP reviewers mentioned many times that having a scoring or rating system specific to them was needed, but we did not get into specifically what that could entail, but just know that further discussion is needed around that, what that could look like. But what closely was related to this was greater explanation, understanding around the scientific scoring system. PFP reviewers didn't always understand what those scores really meant, how they were compiled, and also how their feedback was weighted and whether it was actually included or had an impact. And so for the review panel, this is the review meeting itself. So the recommendation was that there needs to be greater understanding and clarity around everyone's roles. So the PFP reviewers, they wanted to be seen as a meaningful member of that meeting. They wanted their feedback to be valued and respected, but in order for this to happen, everyone, including them, the other scientific reviewers, and the chairs, needed to have a solid understanding of what it was they were bringing to the table and who everyone was that was participating. And so overarching all of that is just consistency in the review process whenever possible for the programs.
Great, thank you. And so final, but not the least, and actually maybe the most important, is just if you could each just give a brief comment about this, the importance of, you know, how do we know that their feedback is meaningful, appreciated, and used? So this debriefing process. So go ahead. I'll let you go, Kristi.
Thanks, Lynn. So transparency was really important. Again, they wanted to know that their feedback was valuable, that it was useful, and that their time was well spent. So really ensuring that they understand as patient family reviewers how that feedback was used and how it was communicated with applicants.
Aggie, any thoughts?
We realized how important it was to let the patient family partner reviewers know which of the teams won funding. Sometimes you have the review meeting, you wrap up, and then I'm so busy writing decision letters to the teams to let them know if they were funded or not, that I forget to go back to all the reviewers. So I think that closing the loop was really emphasized. It's so important to let them know I used their feedback. These are the teams that got funded, and then they can follow along and see how those teams do.
Larry, any final thoughts about that?
Oh, absolutely. The reviewers gave some really thoughtful feedback. So they wanted to know that this was received by the teams. They wanted to know which teams were funded. They want to know even if the teams incorporated their feedback and suggestions that they gave. So what they're really pointing to is the fact that for a lot of these award competitions, we could really support the applicants even further and make sure that the patient partners who were involved in the review understood what all of the outcomes were. And of course, it's important to say thank you and compensate your patient partners. That's how I'll end off.
Yeah, great. And probably very, very important. So I'm just going to briefly say that, you know, even though this project was about the reviewer experience in the reviews, we need to also really highlight that these reviews can't happen in a vacuum. You know, they can't review an application that doesn't have space in the application that is dedicated towards describing how patient and family partners are going to be engaged. The applicants can't build a patient and partner engagement plan into the proposals if they don't even know what that means. So they need the training and support to understand it themselves. And also, as importantly, and Kristi's already highlighted, that the whole funding committee needs to understand what the role is of the patient family reviewer, so that everyone is sort of working together for the same goal, is to find the projects that they feel that are the highest quality, ones that are working with patient and family partners, and the ones that are going to receive funding. So that's kind of the overview. So in quick wrap up, because I know we're kind of running out of time here, I just want to take it back to you, Aggie, is that these recommendations have all gone back to the program reviewers. I'm wondering if you can just highlight one or two key things that you think that you will use, or you think the programs can use from these recommendations.
I think the infographic, like an idea of having a little visual that I can share with the researchers and with the patient family partner reviewers, would be fabulous. I love whiteboard videos, so I'm hoping that we can produce something like that. And then for people in healthcare, an executive summary is always wonderful, because people won't always read a long report, but they'll read a little synopsis that says, these are 5 key things you need to be aware of. So I think all of these are going to be useful for me and my colleagues, but hopefully for other people who run similar research programs.
And Kristi, last word to you. I'm just wondering, what do you think is some of the key takeaways and things that the PERC members are going to be able to move forward in terms of actioning on these recommendations?
So I think not only are they going to be, involved highly with creating these materials and really ensuring that what is created is going to be useful and relevant and understandable, ensuring that we keep their voices as we have throughout every step of this journey, but they're also going to be championing for the uptake into practice, because again, they're part of all these competitions, part of these health authorities, so they can serve to both educate as well as to advocate for these resources into practice.
Great, thank you. Sorry, thanks everyone. Still choking a little bit here. Again, I'm just wondering if Larry, have you been monitoring the chat? Is there any questions or anything that have come up?
Well, there's lots of great comments, so thank you all for your positive feedback on this. Someone was asking if we're going to publish the recommendations, which is, something that we might do. And more importantly, though, we want to create a report and provide some real concrete directions for the organizations that were involved in this process, so that they can work on their, improving or adjusting their own peer review process.
Is there anyone else that's willing to? I'll just stop sharing my screen here.
I think Sandra has her hand up.
Sorry about that. Just took a minute to take off. and it's not letting me in. So I'll just talk quickly. Great point you made on the end about funders. I really think it would be a great idea if it's mandatory for patient partnership. I think we're at that stage. We need to start using those words. The other thing I wanted to know if on these peer reviews was the patient feedback used in the scoring.
I can maybe answer that scoring piece, because it did vary a little bit about whether they were even scored from a patient perspective or whether they were providing narrative feedback. But the most important thing is that that whatever feedback, whether it's a score or a rating system or narrative feedback, is that feedback or score is used to support the funding decision. It's not just a tokenistic, yes, we've done it, I've checked these boxes, I've given you a score, but it's really about how is this feedback going to be meaningfully used. So it's the feeding it back to the applicants. This is their recommendations, and having the applicants understand they're getting valuable information from the patient partners about how they can improve their research. And so even if they don't get funded, getting that feedback and support is probably the most important thing. And that's what the patient family partner reviewers have said, is that, you can maybe score them, rank them, or whatever, support the funding decisions, but it's about making sure that the teams themselves, the researchers themselves, use that feedback so they can strengthen their partner engagement in their research activities.
Thank you, everyone. Lynn, I know these things happen with your dog. These things happen like at the worst of times when you're totally helpless and you can't do anything about it. So I appreciate you forging ahead and continuing with us. Great conversation, and I think it really enhances what we're doing at the CDTRP with peer reviews. So if anyone is interested in learning more about what it might be like to be involved as a patient, family, or donor reviewer in CDTRP funding opportunities, what advice would you give them about how or where to start with exploring this interest further?
Kristi, I'm going to punt that one to you.
No.
Thanks, Lynn. So of course, I think this one has been covered over the last 2 days, but it's always really valuable to reinforce that. So as we know, the CDTRP offers a lot of these similar opportunities, and by all means, you can reach out to Manuel, you can complete their online application, but I also encourage you to recognize that there are a variety of opportunities through other organizations as well. And so whether it may be health specific to you, so if it's related to lung or kidney, whatever it may be, again, as we heard from CanSolve. But there's a lot of different organizations that are also doing this work. So I encourage you to seek those out and to ask how you can be involved, if there are peer review opportunities, or if there's something that, resonates differently with you that you'd want to pursue as well. So you have to do a little bit of the groundwork.
Awesome. Thank you, Kristi. And thank you for a great presentation, everybody.